So as the demographic in our nation changes, the whole concept of elderly patients presenting with heart disease has completely gone away. We have obesity at above 40% of the population. Diabetes is rampant, and more we are seeing younger and younger patients present with heart disease. My youngest patient in the last 3 months has been a 34-year-old with a heart attack. So it's something to be taken seriously, especially if you have risk factors, if you have a family history of heart disease, if you have diabetes, if you are morbidly overweight, if you do not actively participate in any kind of regular physical activity, if you have hyperlipidemia, if you have hypertension, all of those can be very significant risk factors where you have to take your symptoms seriously. So the classic one is, chest pain, which is our chest pressure, which happens right in the middle of the chest. There is also, especially in women and in elderly patients, especially the ones with diabetics, we can have heartburn. Heartburn that does not go away with taking over-the-counter antacids, Mylanta, definitely is one of the biggies. And some people will have palpitations, sweating, nausea, and they will also get some shortness of breath. Those are usually the classic symptoms we see with angina or a heart attack. So the shortness of breath in a heart attack is different from shortness of breath you would say get in a respiratory ailment, like for example, a plain, garden variety pneumonia or a COVID respiratory illness. With those, you will see fevers, you will see an incessant cough, whereas with a heart attack, the shortness of breath is more insidious. It's kind of like you're short of breath, but you don't have the other symptoms. You're not febrile, you're not coughing, you're just short of breath. And the shortness of breath can be even while you're at rest, not doing anything. So kind of different in those aspects from respiratory ailments that cause shortness of breath. So, the more than any medicine or any type of procedure that I could perform, the one thing that people could do themselves that would put them at a much lower risk would be regular exercise or activity. Now, this doesn't have to mean that you have to get on an elliptical or you have to run cross country, but if you could spend 30 to 45 minutes at least 5 times a week with even walking on a level surface, but fast enough to break a sweat. People consider walking their dog as walking. That's not really activity. That's not really exercise. Your heart has to go up to at least 70% of its max predicted. And it's very important that we get it beating fast. That is what the real activity is. So unfortunately, dog walking, which most of the people consider, as an activity for them, is not. But truly, being active to a level of 30 to 45 minutes, 5 days a week will prevent a lot of doctor and hospital visits and medications. So heart is a pump. It's basically a muscle that's going to beat billions of times in our lifetime. For it to beat, it needs nourishment. Heart's nourishment is oxygen. Oxygen is provided by the blood flow to the heart muscle. The blood flow to the heart muscle comes from blood vessels that sit on top of the heart muscle. Over a period of time, with all the risk factors that we talked about, like diabetes, cholesterol, inheritance of bad genes, sedentary lifestyle, cholesterol plaques start to develop in those heart arteries. The more the plaque develops, the more it causes a narrowing of that artery, which restricts blood flow, which in turn restricts oxygen supply to the heart muscle itself. So once we get into a habit of exercising, we develop God-given bypasses to those areas of narrowing or blockage. Over a period of time, if you're going to stress the heart enough where it needs the oxygen, it's going to get the oxygen. It's going to develop what we call neovascularization, which means you're going to bypass the critical areas of narrowing by small hair-like blood vessels that are going to bypass that from all sides. So what that does is, one, people develop those bypasses, naturally, as opposed to what I would be doing, like putting a stent in and opening that blockage per se. Number two is that you develop a heart reserve. When you are exercising above your regular threshold, you're building a backup. In case even if some heart muscle gets damaged, you have enough backup, you've built up enough reserve to survive through an acute event.